Princeton is pretty much like West Virginia in general. We are a very self-sufficient population. We look after one another, we take care of each other.
What questions do you have about heart failure?
I think one of the biggest challenges we faced as a community was the hospital itself.
The West Virginia Hospital Association published rankings of the hospital on how we were performing on some of the value-based purchasing process measures and the hospital consumer assessment of healthcare providers and services patient satisfaction scores. Princeton Community Hospital scored 30 out of 31 hospitals in the state. We all agreed that that's unacceptable.
We looked at that and said, this portrays us as the worst of the worst, and we know that's not the case. And that's when we started our real engagement with the HENs.
2012, our percentage dropped to
about 26%.
The primary challenge that we were facing prior to joining the HEN was commitment. Commitment from all levels of the staff. The commitment to change the culture.
Make sure that case management was involved, pharmacy, education, nursing.
We realized that we needed to involve more people. And this is where we took the 10 individual measurements within the HEN project and we assigned them internally to 10 different individuals, then reporting to the Vice President of Quality.
In the emergency room, we saw a significant drop.
So instead of that individual trying to corral everything, we had more time to work on each project, and people took ownership of that project.
We went 6 weeks without a fall.
I think that was the starting point of all the change.
Discharge plans were made yesterday. She's going to need outpatient nephrology and cardiology follow-up.
Our participation in hospital engagement network has provided us tools to improve quality as well as patient safety. By following their step-by-step approach, we have been able to enhance our quality measures as well as reduce patient harm. One of the biggest advantages we have had is to share the data we have with other partners and to be able to learn from their experience.
Through the efforts of the Hospital Engagement Network, we've been able to achieve the goals of decreasing patient harm by 40% and decreasing readmission by 20%. We've seen a 50% decrease in our overall readmission rate for congestive heart failure.
And that way it's not so confining for the patient.
If you take our numbers and compare us to the list that was published back in 2011, and you take those numbers, we would be third on the list and not 30th. That's how much we've actually improved.
We are looking as a whole in our organization, how do we meet expectations of our community? They want us to deliver the best care right here at home, and our objective is to do that.
Do you think he'll be okay to go home today?
Really, we all have the same problems. They're packaged a little differently in different communities, but we're all doing the same thing, and there's no sense to recreate the wheel. That's what I think the HEN project is bringing to us. Everybody is not having to recreate the wheel. We're benefiting by the successes of others, and then we're just being able to overlay that into our organization and tweak it accordingly to accomplish improvement.
Thanks for tuning in to H&HN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.